Details are now out about the situation in these 5 long-term care homes. I mean, we should warn our viewers that the details you're going to provide are disturbing.
Yeah. They are, and there's pages of them. I mean, the report is a Canadian Armed Forces report that lists observation after observation, specific instances of things they saw, general things they saw that happened more frequently in terms of just an isolated incident. We're talking about, I've got a list here, cockroaches, bug infestations, little or no disinfectant of the facilities, which is bad, never mind that we're in COVID, but especially bad during COVID. Soiled residents. So, basically residents not being changed or brought to the bathroom in time, and therefore they're sitting in perhaps diapers for long periods of time without getting changed. There was an incident of, or more than one incident of forceful feeding that led to actual choking and aspiration. They also talk about patients going weeks unbathed, that the staff there are untrained, or there's a lack of training, that there's a fear of using necessary supplies because they know there's a cost associated with those supplies. At least in one home, there was no crash cart, so nothing to help if someone goes into cardiac arrest. Expired medication, reuse of syringes, which is especially troubling. The list really does go on, Andrew, and
Patients
it is very
wandering.
disturbing. And as you mentioned, this is in 5.
Yes, sorry. Patients,
yes, go ahead.
Patients with COVID, not isolated, wandering around. They were left in the same rooms as residents without the virus. The report that says that some residents were crying for help for as long as 2 hours before staff responded.
Yeah, it really is. When they say it's troubling or disturbing, I feel like that doesn't quite even capture it when you read this report. It's in 5 Ontario homes, but as Doug Ford, the Premier of Ontario, just said, he suspects that these problems are certainly beyond those 5 homes. We also know that the Armed Forces has been asked and has been working in 25 Quebec homes. And we are hearing that there will be a report coming out about those homes as well from the military, although we're told perhaps it's not quite as severe as what they saw in the Ontario homes. Although we do already know that there has been problems highlighted in the Quebec homes during this crisis, because the government had to actually go into one home when staff basically just left because they're a fear of COVID, and residents were left completely unattended.
Home on the West Island,
Yes. So I mean, it's not like it's not like we don't know that there are problems. And in fact, that is a constant question that comes up for Doug Ford and the Premier of Quebec as well. This is not, these are really disturbing specifics, but it's not like we didn't know for years that there were problems in these long-term care homes.
And we should point out that, we talk about the 5 because the Canadian Armed Forces were asked to help in 5 long-term care homes in Ontario. So those are the 5 where they observed these problems. So it doesn't mean that it's just happening in 5, as you were pointing out. It's just that they can only report on what they saw. And what's incredible about this, Karina, is they felt the need, the military felt a need, and the report is here, so it's all public, felt the need to put pen to paper and to say, this is really disturbing. You need to know about this. The public needs to know about this.
Absolutely. And, when you talk about just the 5, yes, that's where they were observing. But we also know CBC, our colleagues have done reports just recently in April about how in Ontario, I think it was like 9 out of the 626 homes in the province in 2019 got in-person inspections. So that's, unbelievable that the majority of homes did not get any kind of in-person inspection. And so we know that obviously has to get fixed. But it's not like inspections were high, the year before, but it has consistently dropped off over the years.
And we're going to get into that with a Toronto reporter soon, because there were lots of questions to Doug Ford about, well, wait a second, you've been Premier for a couple of years. I mean, you're sort of talking about how appalling all of this is, but there's this whole question of accountability. Well, who's accountable? Different governments are in power at different times. But once you're in
Andrew,
for go ahead.
Can I actually point out? I remember covering the 2007 Ontario provincial election, and this was a major election issue during that campaign. That's many years ago. It goes back. I mean, subsequent governments have failed to deal with this issue.
So what did the Prime Minister say about the findings earlier today?
Yes, so Prime Minister Justin Trudeau also calling the report very disturbing, saying that he read it in full yesterday, and he was asked how he felt when he read this report. This is what he said.
On reading the deeply disturbing report, I had obviously a range of emotions of anger, of sadness, of frustration, of grief. It is extremely troubling, and as I've said from the very beginning of this, we need to do a better job of supporting our seniors in long-term care right across the country through this pandemic and beyond.
Now, long-term care homes are under provincial jurisdiction, so obviously lots of questions to the federal government. Okay, so what can you do to help? Perhaps, obviously, money could be the support that they're offering. Obviously, if we're understaffed and people aren't being paid enough and there aren't good standards in a home, well, then, money could make a difference. But really also questions about what the future of long-term care would be in the country. Perhaps it should, Doug Ford talking about perhaps we need standards across the country, not just in one province. Well, does that mean it would start to come under the Canada Health Act, which would then put it under federal jurisdiction in that way? What's the future of for-profit long-term care homes? Is that a model that should continue? And certainly the province of Ontario asking for money to do a deeper dive, but Doug Ford also being asked, well, we kind of already know what some of the problems and fixes could be, what could be done more immediately. And the health minister for Canada was also, Patty Hajdu, was asked about that, and she was quite vague. We'll give support that we can and money and perhaps staff. I mean, we've obviously already put the armed forces in, but it's not quite clear how the provinces and the federal government could come together to solve the problem when you have these jurisdictional issues, but everyone agreeing that something has to be done. And a lot of people arguing also it shouldn't have had to come to this point with a military report for people vowing for change. And
it was interesting to hear Doug Ford, the Premier, call on the Prime Minister to help us fix this. No province can fix this alone. So, as you point out, it's a provincial jurisdiction, but it sounds like that's a call for money or some kind of assistance. Karina, we are going to come back to you because we're going to go to a question period soon. But for now, thank you. That is the CBC's Karina Roman live in Ottawa.